Disc desiccation is one of the most common features of degenerative disc disease. It refers to the dehydration of your discs. Your vertebral discs are full of fluid, which keeps them both flexible and sturdy. As you age, the discs begin to dehydrate or slowly lose their fluid. The disc's fluid is replaced by fibrocartilage, the tough, fibrous tissue that makes up the outer portion of the disc. The first sign of disc desiccation is usually stiffness in your back. You may also feel pain, weakness, or a tingling sensation in your back. Depending on which discs are affected, you could also feel numbness in your lower back. Disc desiccation is usually caused by wear and tear on your spine, which happens naturally as you age. Your doctor will likely start with a physical exam. They may ask you to do certain movements to see if they cause any pain. This can also help your doctor figure out which discs might be affected. Next, you will likely need an X-ray, CT scan, or MRI scan to give your doctor a better look at your vertebrae and discs. If your symptoms are mild, your doctor may advise you to maintain a healthy weight, practice good posture, and avoid common back pain triggers, such as lifting heavy objects. If your symptoms are more severe, there are several treatment options that can help, including medication, massage therapy, physical therapy, and spinal injections. Disc desiccation is a normal part of aging, but there are several things you can do to slow down the process, including exercising regularly, maintaining a healthy weight, not smoking, staying hydrated, and maintaining good spinal posture. So this is all about disc desiccation. Thanks for watching this video. If you enjoyed this video, please do not forget to like and subscribe to our channel. In this channel you will get information about various health-related topics. Wishing you good health in your life. Bye.